Hi, I'm Steve Rowe, Executive Director. Today is Tuesday, February 1st, and I'm recording the update that you will see on Wednesday, February 2nd. I'm going to start with some good news. We tested all of our health center residents on Monday, just yesterday, and there were no positive tests. So within the health center, we continue to have no cases of COVID. We also tested all of our assisted living residents yesterday, and there were no new positive tests for assisted living as well. That's especially good news for assisted living because it means that unless we have a new positive test sometime this week, which would only occur if somebody was symptomatic and we tested them because they were symptomatic, that we will be able to come out of isolation procedures for assisted living people as of Friday. So that is our plan, and it's like hopefully we are able to do that on Friday because we haven't had any new positive tests through this week. I also do have some bad news. We learned today that we have 2 new resident cases within independent living just within the past 24 hours. So that clearly is concerning, and Kim and I started to talk yesterday about when we would be able to relax the restrictions and allow in-person dining and get back to a regular program schedule. And where we are, or at least where we were yesterday when we were talking about this, is that we wanted to see 2 consecutive weeks where we didn't have any new resident cases. So as of today, that would put us at about February 15th for hopefully relaxing the in-person dining and the program restrictions. And that assumes that we continue to have a downward trend in cases and that we've had no new positive independent living resident cases. But again, we just had 1 or 2 within the past 24 hours. I think that's enough about testing. Recently, I want to talk a little bit about boosters and a mandate that we will be requiring for employees. We, as you know, we were ahead of the game in terms of putting a vaccine mandate in place for our employees. We did that effective July 1st of 2021. Some of you who follow this news know that there were court cases that kind of challenged the OSHA regulations for employers that were at least 100 people that required all of those employers to have vaccines mandated for their employees. And then there's a different set of court cases related to healthcare settings. So the OSHA one for just general employers, that was struck down by the courts. But the one for healthcare settings was upheld. And so it's like there is a vaccine mandate for care settings like Oak Knoll that is in place or will be in place sometime this month, I think was the deadline. We, of course, have been ahead of that and started our vaccine mandate back last summer. So we really don't have anything to worry about from that standpoint. But we are going to require our employees to have the booster shot effective no later than March 15th of 2022. Many of our employees already got the booster shot, and we've done or will be hosting at least one more booster clinic for our employees to receive that. But it will become a condition of employment for our Oak Knoll staff effective mid-March. Some of our employees might be a little concerned about that because they had negative reactions to a dose of the regular vaccine, and I understand that concern. However, getting that next dose of vaccine or the booster dose is still significantly better than actually getting sick with COVID and potentially being hospitalized. So we are comfortable with the mandate, and we absolutely expect that at some point the regulations that Oaknall lives under will require that a fully vaccinated person actually means fully vaccinated plus boosted. So we think that we're just going to be ahead of the game there again, and that has been communicated to our staff. I think the communication went out yesterday to everybody. One more idea about boosters. Kim wanted to make sure that I told you that there has been guidance recently or an approval for a second booster for people who are immunocompromised. So if you consider yourself to be in that category, you may want to consult your physician and see if you should be in line for a second booster dose. So enough about boosters and vaccine. Case counts within Johnson County are still ridiculously high. We have data through last Tuesday, January 25th. A new set of data will come out tomorrow on Wednesday. The positivity rate just crept down very, very slightly from 27.9% the last time that information had been updated to 27% as of last week. So down basically 1%. And then the average daily case count a couple of weeks ago when I recorded it was significantly over 400 new cases per day. Today it's under 400 new cases per day, but again, obviously much, much higher than any of us are comfortable with, but it is at least trending in the right direction, which is down. Hopeful that we'll continue to see that trend down over the next couple of weeks so that we can get back to in-person dining and a normal program schedule. I'm going to end the update in the same way that I started the update with some good news. Late last week, we signed another contract for an East apartment, and that gets us down to, out of the 60 apartments that we have at East, only 4 that don't have contracts on them. And of those 4, 2 are actually on hold. So as I was signing a contract with a new resident household, Retha was showing another household around, and they ended up putting an apartment on hold. So we have 2 on hold and 2 that are still available. If you have any friends who have been on the fence and just kind of waiting until the last possible moment, that moment is coming. We only have 2 spaces that aren't spoken for. They're both nice 2-bedroom, 2-bath apartments, both courtyard facing level 1 apartments. One is they're both in pet friendly buildings, one in building 2 and one in building 3. So just wanted to put that out there. If you know of anybody, please send them my way. I'd be happy to talk with them, and either Retha or I will meet them and tour and answer questions. Thank you for watching this update. It's easy to get discouraged when we keep having positive tests, either with employees or residents, but we do believe that the end is near. We know that for the people who have been vaccinated and boosted, when they do test positive, they're not getting real sick. So people have been generally just kind of mildly symptomatic, maybe feel like they've got a cold or the flu, but nobody's really gotten terribly sick. Nobody has needed to be hospitalized, and we've certainly not lost any residents or employees due to COVID. So I do feel cautiously optimistic that we're nearing the end. I hope that's true, and time will tell. Thanks for sticking with me to the end of this video, and we'll see you again in 2 weeks. Bye.